I'm Kerry Evers. I am co-president and CEO of ProChange Behavior Systems. ProChange has been around for 21 years. We just celebrated our 21st anniversary. And we were founded by Jim Prochaska, who's the developer of the Transtheor-whatical model. And we work to integrate evidence-based behavior change into a variety of different programs and products.
My name is Sara Johnson, and I'm the other co-president and CEO of ProChange Behavior Systems. And Kerry and I really think very strategically about leveraging each other's strengths to help address the needs of our clients and our research partners. So we work on a variety, as Kerry mentioned, a variety of initiatives to help advance the science of population health and well-being. The Mark Dundon Research Award is an incredible honor for our partnership and for each other and for our organization. The esteemed list of previous Mark Dundon Award winners is a group of individuals who have been role models to Kerry and I throughout our professional careers, and we are just incredibly honored and grateful to have received the award.
And in addition, this award really is a celebration of the partnership and collaboration that Sara and I have had, both with each other, but then also all of the research that has come out of ProChange with an incredible team of researchers and developers and innovators, really, that we have on our team. So we really view this award as something for the company. And it's really special in that it's honoring a collaboration in research, which you don't often see. And we know that research really happens in collaboration. So we're really proud to be able to be the first that have received it as a duo.
Some of the work that I'm individually most proud of is the work that our team did in the area of weight management with regard to our ability to demonstrate impact on both exercise, healthy eating, and emotional eating on a population basis long after the intervention was over. And similarly, that fed into some really exciting research on multiple behavior change, which we've been hearing a lot about in today's session. And we're really excited about the way we've been able to advance the science of simultaneously intervening on multiple behavior change.
Some of the other work that I really enjoy highlighting is work we did looking at some of the studies that have been done on employee health and the programs that have been done there, looking across a series of studies and what those rates were in terms of how many people were able to change.
So I think when we're thinking about tips we might offer to employers, one would be to collaborate with other organizations who can help them rigorously evaluate the program if they don't have the wherewithal on their own team to do that, but also to rely heavily on the evidence base that's been developed. It's so easy to fall into the exciting trends that are happening and to overlook the evidence base, but we would really encourage people to continually remind themselves about how important it is for all the behavior change efforts that we're implementing to be really firmly rooted in behavior change science.
The science has been built over several decades and is really provides some great tips in terms of how to intervene with individuals with your employers. However, I would also say that coming from the perspective that ProChange uses the Transtheor-whatical model, we're able to look at changes people make along the entire continuum of change, and not just when they actually are taking action, which would be kind of the point at which they're showing that change outwardly. By taking a look at the entire continuum, you can see that your groups and your programs are really making progress, and see that you're making incremental progress along the way. It's an important aspect not only for your populations in terms of keeping morale up and being able to recognize that success, but also for you in terms of implementing your programs to see how successful they are being.
So we occasionally get asked, what is the Transtheor-whatical model? It's really an integrative model of behavior change that allows us to completely reconceptualize the behavior change process. So historically, behavior change has been viewed as a relatively all or none phenomenon where you administer some intervention and hopefully some proportion of the population adopts the behavior change you're targeting. But if instead we totally reconceptualize behavior change as a process that unfolds over time as the progression through a series of 5 stages of change, we can really begin to understand not only how to meet the needs of those who are ready to change, but also how we can tailor our message to better meet the needs of those who are not yet ready to change. So it becomes a complete game changer with regard to how you can engage an entire population.
And it's important to recognize that stage of change is only one aspect of the Transtheor-whatical model. The name Transtheor-whatical came about specifically because it was looking across all of those techniques and communication messages we have. And really what stage of change gives us is the map of when we should be using different strategies and techniques and principles of change at what point in time. So you'll hear people talk about self-efficacy or education and knowledge or emotional response. And all of those are a part of the Transtheor-whatical model, which gives you the map of when to really tap into those principles and processes of change for each individual person. One of the benefits of working very collaboratively with Sara and what we've been doing over many, many years at this point is we have very different perspectives, very different curiosities and skills and knowledge. And by using those, we're able to have a bigger impact in terms of any of the research or the program development we do. And what we've learned to do, collaboration isn't always easy, but what we've learned to do and what we enjoy doing is really noticing when our different strengths can come together, when one person really needs to step in a challenge versus the other because of our strengths, and when we really need to collaborate and come up with a better response or a better solution that either one of us individually could come up with.
And I think we've been so fortunate to have one another and to have the other members of our team, so that whenever you're faced with a research challenge or an application question, we huddle and just compare ideas and compare notes, and it's through the diversity of perspectives and diversity of insights and expertise that you can really arrive at the best solution.